Welcome to CNNMoney Switzerland's summer series on megatrends. Today we're talking about digital health, and I'm joined by Luisa Dobre. She's the CEO and co-founder of Komed Health. Hi, Luisa.
Hi, Tanya.
So I saw that you mention often that the health sector is still in the Stone Age. I was wondering, what do you mean by that? Can you give me a few examples?
Sure. Actually, this is a quote from Jeff Arts, clinical director that we have been working with. He said, every time I'm outside of this hospital, I have all the latest technologies, gadgets, and then when I'm in the hospital, I work with pagers, with DECT phones, switchboards. We waste a lot of time to just find the information I need or the person I need to talk to, and this is extremely frustrating, especially when you treat patients.
Yeah, it's crazy. I mean, now during COVID-19, we also saw that they have to give the information through fax. I mean, who uses fax nowadays?
Exactly. So actually, 42% of the healthcare communication happens by fax, which is insane.
Yeah.
I witnessed, we spent a lot of time in the hospital, and I witnessed a communication between radiology and emergency, and an emergency physician came quite angry at the radiologist, said, "Oh, I sent you this fax, where is the result?" I said, "Which fax do you mean? I don't know, which do you mean?"
Wow.
So for me, it was shocking. I was like, seriously? We are in Switzerland, and it's so important that the information reaches fast, especially when we are talking about emergency patients.
Why do you think is that? Is it a mindset thing?
I think historically it started like that, back in the days, fax, pagers were considered like to be more robust. It's also legislations. Probably you also saw it during COVID-19. In order that a recommendation or an order from a general practitioner to the hospital happens, or vice versa, in order to be considered legal, it has to be sent by fax. And during COVID-19, they basically had to overcome this and use emails, because otherwise the process would have been too long and they would not be able to react. So I guess for me, it's also after COVID-19, from my point of view, a lot of these legislations will change, because otherwise it's impossible to be fast.
Do you know how much the cost is for that inefficient communication when it comes to money or even lives?
So, for example, I was just reading this morning an article that it was a research done that a hospital with 500 beds loses about 4 million per year due to inefficient communication. And there are biggest researches that we have referred to also on our website, that about 250,000 of people die in US because of inefficient communication. This costs the healthcare system in US about $12 billion. And in Switzerland, there have been also some studies made that 1,500 people die because of this reason. Because you imagine, in the moment you deal with these ancient ways of communication, and when you need to take fast decisions, sometimes the information can reach too late, or can be not fully for somebody to take the right decision.
And that's exactly where you're stepping in. You want to try to bring the health sector to the 21st century. Tell us what exactly you're working on. It's a collaboration communication tool, right?
Exactly. So 4 years ago, we started Komed Health, myself and my business partner, which comes from the technical background. I come from a business background, and our vision is to help doctors, nurses to save lives. And for me, the reason why we started this company is because we came across those articles saying that quarter of a million people are dying every year, and for me it was shocking. And I was using tools like Slack or other communication platforms, and I was wondering why something like this doesn't exist in healthcare. And then we said, okay, let's actually do a lot of research to understand the problem, because is it relevant? Would it work, such a tool?
Is it needed?
It is needed. Maybe we miss something. In the first year when we started, before even writing any line of code, for us was very important to understand the problem before developing a solution, right? And I remember we were going from hospital to hospital, stopping doctors, nurses, asking them for 5 to half an hour. Some of them even became our advisor, medical advisor, to share with us their problems when it comes to communication. And by now, we spend more than 3,000 hours shadowing physicians, interviewing physicians. We already lost count, but this is how we developed our application. So basically what we do a secure communication and collaboration platform. You can think about it as easy as WhatsApp. It's very easy to use. It can be downloaded on any type of mobile device, iOS, Android, but also on a desktop computers. And the value of it connects easily with the existing systems in a hospital, basically with electronic patient record. So in the moment a patient comes to the hospital, we create a chat room with the name and the demographics level of that patient and invite the relevant physicians.
So like a WhatsApp chat? Like
a WhatsApp chat, exactly, but it's just around the patient or even around the role, like let's say on-call surgeon. And every time an event about that patient happens, we send notifications. Lab result is ready, radiology report is ready, the vital signs are too high, too low. And also we add and remove automatically as much as possible the members of that patient chat. So basically it's always dynamic.
So you're trying to replace WhatsApp, fax, pagers, all that as a tool of communication with your app and platform. Why do you think it's better? What makes it better?
So instead of having 5 to 7 communication platforms that are not connected to each other, you have one that you can message, you can call, and you have always your mobile phone with you. And as a doctor, you are at the elevator getting your lunch, and you get proactively a notification, the report is done, and you can immediately reply. It speeds up the care process very fast. Also, of course, doctors are using WhatsApp because they don't have other tools to communicate, and this created a lot of problems because WhatsApp doesn't protect patient data, and it's against the current regulations. And this is why also a lot of hospitals have approached us proactively because they're interested in the security, which is at the core of developing our application.
Just about to ask that, security, safety, how do you make sure that the data stays protected? I would say probably you make sure that it stays on that app.
Exactly. So basically, we have a Swiss cloud-ready solution or Europe EU solution, depending if we have EU customers, or we also offer it on-prem. So for big hospital chains, they prefer to have it on premises. We also offer that. And then when it comes to the application itself, we have the way the application is built with the highest technology in order to ensure security. And last but not least, we also work with partners. For example, when a hospital has bring your own device, we can provide them an MDM, which is mobile device management. So basically,
you bring the mobile devices with.
We can also do that, but also to protect the data on the phone. So, for example, if somebody reports a stolen mobile phone, we can erase automatically the data on the app.
And who owns the data?
Obviously the hospital, the patient, but this data is not to replace, just to be sure that I am understood, is not to replace the patient history data or electronic medical record. It's about communication, real-time communication, collaboration, and about sending notification when the event of a patient is ready. So instead of the doctor going proactively to the radiologist, finding out when the report is ready, instead of making I don't know how many calls to find a very simple information, this information proactively comes to him or to her, and this is when the process is kicked off and it's speed up.
That's a good keyword that you mentioned, that it's not a record database, because Switzerland is working on this electronic patient dossier, which is taking quite a while, and also the Tagesanzeiger wrote on the 15th of July that it's been postponed again. There are a few forcing-backs, and the company that was supposed to do it is delayed. So I was wondering, once we have this digital electronic patient dossier, will you still be needed? Is it a competitor?
Of course. Actually, for us, digitalization is a trend that makes our product even more relevant. These initiatives like creating a whole electronic health record, connecting the data of patients from different hospitals, we can be a perfect partner and enhance the value on any type of EHR, EMR by connecting our platform, which is really referring to speedy communication and notifications triggering on such a platform. So as I mentioned, for us, we are not a database, we are not an archive base. We can push the information that has been exchanged in our chats back into their system, but we are not a creator or an archiving system.
So it would even help you if it existed at some point?
Exactly. Mm-hmm. These would be the perfect partners for us.
Yeah, but it seems like it's taking some time, and comparing to other countries, Denmark or in the northern, we're so much behind. Could you imagine why that is? Like, I mean, Switzerland is such a developed country in digital health.
That's a good question. I will not be able to say exactly why Switzerland is behind Denmark or Finland, which have digitalized most of their patient records. Probably it also has to do with history, with the legal environment and so on.
Do you think the cantons play a role?
I think as well, because you have all these different cantons. I think this is a very good point. And you have different legislation, and the whole political aspect is not very straightforward. It's very much decided canton by canton. So I think this is one. But what I see as a trend is the fact that COVID-19 happened accelerates the digitalization. So I think it's really a generational movement what we are all experiencing now, and it's actually of course it affected a lot of us. But on the other hand, I see an opportunity that now also healthcare will adopt digitalization and accelerate it as other industries have done it, like the banking industry.
Mm-hmm. You can feel that with your company.
Totally. So we have several projects. We have several customers in Switzerland, and one of our customer, which was in the hot zone of Switzerland, in the Italian part, in Ticino, decided to roll out our application during the crisis.
Yeah.
We saw a spike in the usage of that platform, and then they decided to roll it out during the crisis. So I would say that we are also proved to work in such a crisis. And today, actually even today, this morning, I had a call with a hospital in Germany, which are interested now to start as soon as possible a project. And the CEO, the first word he said, or the first sentence, because of COVID-19, we need to accelerate digitalization. We didn't plan this for this year, but we want to have it rather sooner than later. So it was a matter of having in the next 2 weeks, not 2 months. I never seen a hospital so keen to digitalize, talking, no, we need it in 2 weeks, not 2 months.
That's amazing.
And this is like, I was like, wow, what happened?
So and who else is using your tool? Do you have a lot of hospitals, or are there few that are just testing it? I mean, these seem to really be your clients now.
Exactly. So we have we have conducted 7 pilots to date, and now we have 2 customers. We have secured our first rollout in 7 hospitals. I mentioned about Ticino, so this is where it's our biggest client currently. And we plan in the next weeks actually go to Germany.
Okay, so that's the next step,
so now
expansion.
Now it's the time for us to also expand. So it was interesting because we were supposed to start 4 projects in Q2. And of course, we couldn't access our customers anymore. What we normally do, we couldn't meet our customers. But we realized immediately after the crisis, the first wave has finalized. We got proactively engaged by customers, and this is great. So on a short term, it was probably not as we planned, but medium long term, I see a huge peak.
Maybe one more. Your communication is a problem in health sector. Is there anything else that you see that you think, oh, that is interesting? Maybe you're not involved in it, but that would be needed in digital health.
So I think it's an ocean of opportunities in healthcare. So if I would want to start a company, I would still start it in healthcare because there is so much happening at the moment. Of course, everybody talks about telemedicine, so communication of the patient with the doctors outside the hospital. You know, like now we are talking about acute patients or chronic patients that need to engage before coming to the hospital with a doctor and after. This is something we are also looking into to enable communication with the doctor. Another aspect of digitalization, I think, is medical research and implementing medical research into a real setup. I think there are a lot of changes happening there. Also, longevity is definitely a very interesting space to go at the moment. And everything that holistically takes care of the patient before getting sick, by mind, body, and soul, and afterwards, so preventive medicine, ambulant medicine, and all of that.
Great. Luisa, thank you so much, and all the best for your expansion.
Thank you so much, Tanya. Much appreciated.
Thank you. And thank you for watching. And don't forget, if you missed any of our content, then go on cnnmoney.ch or check out our social media channels to catch up with all of our content. Thank you so much and goodbye.